Thank you for joining us for this digital roundtable on altering practice workflows around COVID-19. My name is Carissa Miller. I'm the Program and Communications Specialist for Montgomery County Medical Society. I do have a few housekeeping items for us before we begin. We have muted participants at the beginning of this call for sound quality purposes. So particularly if you have joined us via a phone call today, make a note that if you'd like to unmute yourself or remute yourself, you just hit *6. On a PC, it's Alt-A, and on Mac, that's Shift-Command-A. Or you can use the black bar at the bottom of your screen to mute and unmute yourself. There's a little microphone icon that you can use there. Today, we're trying to simulate the experience of one of our in-person roundtables. So please feel free to unmute yourself throughout the webinar to contribute and to ask questions. We certainly do want to have that back and forth interaction. Today's roundtable will address changes to workflows, patient communication, the addition or expansion of telemedicine or virtual visits to your practice, PPE supply shortages, and more. So I'd like to thank our facilitator for this discussion, Ariel Hester, who is the practice manager for Maternal-Fetal Medicine Associates of Maryland. Thank you for being with us, and I'll go ahead and I will turn the session over to her at this point.
Thank you, Carissa, for the introduction, and thank you to the Society for putting together this digital roundtable and giving us an opportunity to speak with all physicians and practice staff today. It's especially helpful. Thank you so much for that. So as you all know, we're currently in an unusual time that's full of a lot of questions and concerns. It's our ability to look to one another and to talk with each other and talk through some of the things that are similar things that we're experiencing in our office and ways that we can overcome them and still provide the best patient care while protecting our staff and our community. So as Carissa mentioned, there are 4 topics that we'll be discussing. And Chris, I'm sorry if you've already said this, but because the digital format is different than what we're used to when we're at Montgomery County Medical Society, I just thought if you would like to talk, if you could just please first say your name and what company you're with. But the very first topic that we'd like to go over is how is your practice managing changes to workflow? Each day brings new changes to our facility, new challenges, new changes, but what has worked the best with us was to implement a tool that we could use for communication in-house. And what we did was we created a preparedness manual for our staff, and the preparedness manual goes over general guidelines. It has updates to our telehealth program, new policies, for example, our new guest policy, but it also addresses workflow updates for each department individually. The manual, it was needed definitely, but it was well received by both the staff and the physicians. I'm sorry, I'm getting a little background noise though, but having a clear directive, it has reduced the anxiety in our staff, and it helps to keep each and every one of us on target with our day-to-day procedures. So what would anyone else like to share how they're managing the workflows in their facilities?
Just a reminder that you can hit *6 to unmute yourself or use the black bar at the bottom of your screen and hit that mic button.
There were a few additional things because as you are probably seeing in your practice similar to ours, is that we're seeing anxieties with our staff, and things that we have done here to kind of help with that is in those manuals, we provide them as much up-to-date information as to what's going on as possible. And even yesterday, I did little healthcare hero gift boxes for the staff, just something simple that we could do. And it just included a box of tissues, a roll of toilet paper, soap, and wipes, and even some spring bulbs for planting sunflowers. It's just that little thing to show them that we appreciate them and that we're all in this together. And working full days in clinic makes it not as easy to go to the grocery store and get the items that you need first thing in the morning and stuff like that. So it was something that definitely helped in our organization, just having that one set place where everyone can go for information, and knowing whenever information gets updated, we just say, hey, check the manual each day for any changes. And it really has helped with the workflow. It even goes into detail in our manual about verbiage to use with the patient so it's consistent from department to department. Our new no guest policy was one that is a harder one. I mean, we work in maternal-fetal medicine, and so people want to have their spouse with them. People want to bring their children to come see the baby. But for us to have that same clear verbiage that we could use with each patient each time to help them better understand the importance really made a difference with staff and with our patients as well. Now, I wanted to leave another moment in case anybody had any input that they would like to say for that, but we can move on to the next topic as well, which is patient communication and how that's changed for groups. Now, we utilized our website. So as we know, changes are happening every day. So we put updates on our website, including updates to our guest policy. Here currently, we have no guests allowed to come with the patients, and that's for the protection of the patients and our staff here in the clinic. So that's one that we put up. And then what ended up working out a lot better for us, we originally used a broadcast manager service that provided an automated phone call and text message to our patients to let them know of updates and how to better prepare for the appointment they had the next day. But what we found is by directly contacting the patient by phone, having a member of our staff do that, we were not only able to address concerns and questions that the patients had the day before their appointment, but we were also able to do pre-screening on the telephone with the patient prior to them coming in, using the algorithms that were provided to us by our guiding entities, which is for us, ACOG and SMFM. So we got a really clear look of, did we need to reschedule this patient? Do we need to redirect this patient somewhere else? Do we need to hold up on this appointment for now? Or do we have the patient come into the office the next day? With having those questions answered, it really gave the staff a lot of confidence too when dealing with the patients, because as the patients come into our office that next day, they know they're gonna have another pre-screen questionnaire, and they know what to expect as well. Now, did anyone else have any other input that additional communication channels that they have that have helped in their practices right now? And Chris, I'm not sure if you're seeing any questions come across, typed questions. I'm unsure of that.
Not yet. Let me go ahead and I'm going to hit unmute all on everybody. So if you do have a lot of background going on, please be prepared for that. I just want to make sure that everybody has a chance to contribute if their unmute feature isn't working very well. So all participants are now unmuted.
Yeah, because what we really want to do here is similar to the roundtable meetings that we have at the society, where we bounce off new ideas from each other and we see what works and what doesn't work. What didn't work for us was that broadcast manager feature. Though it was simple to have an automated service kind of take over some things, to have that direct patient communication, it gave us so much more than the patients just what to expect when you come into the office.
So Ariel, this is Susan D'Antoni. Hello, everyone. I wanted to just comment that it was anticipated that there were going to be patient communication templates on the Maryland Department of Health site. So while I honestly have not gone to look for those, if your practice is still struggling with, kind of what to say, that might be a resource. Carissa, do we have that on our website yet in terms of a link? Do you recall?
We do have a link to it on our COVID-19 resource base. So that's under the section about practice workflow alterations that you can make. So that's available there.
That's great.
I will also just say that as a patient, I've received a lot of emails from various specialty practices. So if you are a specialty practice and say you're an allergist and you're still offering shots for patients who might need them in your office, because that is essential for a lot of patients, that's really helpful to know. And so certainly I think that on the patient side, seeing that communication, seeing my practice as a source of information has been really encouraging and really helpful.
Now, are a lot of you getting a lot more phone calls from your patients with questions than you previously had before in relation to COVID or just in general for their upcoming appointments? I see the questions have increased in our office, but not significantly. I was wondering what other practices we're picking up on now.
Or are people using the portal, if your practice has a portal, to ask those kinds of questions as well?
Now, our practice more so getting information along, from telephone than the portal that we use here in the office. But each practice is different, so I'm always interested in hearing what works and what doesn't work with that too. So moving on to the next one, do you guys already do telemedicine? I mean, have you had telemedicine before, or are you currently using telemedicine? Our group, what we've been doing the past year was a form of telemedicine that allowed our physicians to connect with physicians in outside networks. And they were able to, in real time, consult with patients. For instance, let's say we saw a fetal abnormality. We could consult with the outside physician right in the exam room while the patient was here. Oftentimes, it's invaluable to us because it gives us an opportunity to make a change to patient care in real time, and there's no delays between the consult of the two doctors. So it's really helped us, but with COVID, we've now had to expand our program to not allow for just the outside physician to our in-house physician, but our in-house physician to our patients. We were very fortunate that we work with a telemedicine vendor already, and we were able to communicate to him what we needed for our practice, and we were able to accomplish that fairly quickly. What's some of the experiences that some of you are having with telemedicine?
I see in the chat box that Endocrine and Diabetes Associates is now doing telemedicine, so that's wonderful to hear. I also just want to point out that Montgomery County Medical Society is offering a Survey Monkey where you can respond about whether your practice is offering telemedicine visits, whether they're doing visits inside the practice, and we're creating a listing. So if you'd like your practice listed on there, we'll send that link out after this, this webinar, and we really encourage you to participate and let us know if you're still taking new patients and all of that. So we'll definitely get that out afterwards.
That's great, Carissa. I'm interested in hearing what telemedicine programs groups are using. I hear, you know, CMS has opened up so much more with the telemedicine. I've even gone as far as to hear people are using Facebook and things like that. I'm interested in hearing what some of the practices are using for their telemedicine.
Now with both of them, should be how do I add you? No, I think because we're on the same now.
So Ariel, this is Susan again. We've heard a number of physicians to comment that they're using Doxy.me, that they found that to be an easy solution for them, relatively easy. Also, of course, we did a telemedicine webinar and would encourage people, if they haven't instituted telemedicine yet, that webinar was excellent to go through the hardware and software requirements and how to evaluate a telemedicine vendor. Did you want to, subscribe and pay? Is there integration with your EMR, or is it a standalone product? And some of them, of course, if you're, a very small practice and you don't have the staff maybe to even set those calls up for you, some of them do offer a virtual assistant, such as Simple Visit, to help
Great.
call the patient, make sure and troubleshoot that, and then the physician gets a message on their phone that, Mrs. Jones is available now for her appointment. Now, that's not without a cost, of course. And
Yeah.
so right now, I think Simple Visit is charging $5 per call. But when you think about the physician's time or staff person's time to be doing that and all the difficulty of the different platforms, that could well be worth it, especially since you can bill telemedicine. It's not lost time. So just a few thoughts about that. Is anyone on the call already doing telemedicine? What platform are you using?
I see in the chat box that we have a couple of responses to that. So it looks like Amber Brown from Maryland ENT Associates is using MyPrivia for telemedicine, and that they feel they've been very successful with that so far. And I see also that Dawn McCormick from Endocrine and Diabetes Associates has had a great deal of luck with Backline, which is a doctor first application. And they've been doing regular visits with an audio visual component.
That's great.
And Backline is offering that free trial right now. So it's the first 30 days, it's available at no cost to folks.
Now, some of these folks who are using the telemedicine, are they seeing new patients with the telemedicine? I'm interested in seeing how you get your consent forms and your new patient paperwork and things submitted to you with signatures prior to the telemedicine appointment for your new patients.
And don't be bashful. We want to encourage people to share their experience. So I see that Dr. Pham just joined. Dr. Pham is often a font of knowledge. Dr. Pham, I'm wondering if you could share what's happening in your practice since you are a part of this large ENT practice. Are you seeing new patients via telemedicine, and how are you getting those consents, et cetera, signed in order, and the consent signed so that you can do telemedicine with a new patient? Dr. Pham.
I'm sorry, I just logged in and then couldn't hear anything that you were saying. Sorry.
Oh, so I saw you, and I was so
meeting.
I was so excited because I thought you might share. So
Yeah.
we're just trying to find out how are you approaching the use of telemedicine with a new patient, or are you? And if so, how are you getting that consent to do telemedicine?
Okay. Thank you for the question. This is Annette Pham, otolaryngologist, or ENT, and currently I'm actually not seeing any new patients via telemedicine. It's really just my established patients, and the reason I did that way was because I could confirm their identity. Because I know them. As far as managing the consent, I think that has been a little fluid and evolving, especially with the relaxation of some of the regulations with regards to forgiveness later on. I think for us, what we've been doing is we've been offering to the patients, the established patients, when they call, and then if they agree, we take that as an agreement. Certainly once everything is all done, said and done, we'll have a form that they'll sign for telemedicine for the future. But I think right now we've just been taking that via a verbal, and then again, just established patients, because I don't think I have the bandwidth to sort of manage and see new patients. And many new patients that we're seeing, they end up being new patients that are urgent, emergent anyway. Most people are not seeking ENT care, as a new patient unless it's something urgent, because I think at least what I've been seeing in our area is that most people are not wanting to go out to the doctor. We've had, even in the last 2 weeks, we decided as a large practice of 62 doctors across many divisions, 17 divisions across Maryland, Virginia, and DC. We had already decided to limit our practice to urgent and emergent patients because ENTs have been in a unique situation of possibly being higher risk, along with ophthalmologists and dentists, with regards to a lot of things we deal with in the mucous membrane. The viral load is highest there that we're finding. So we've already been sort of limiting, and as a result, patients were already calling in saying, oh, I don't think I want to come in for my tinnitus or ringing in the ears. Does that answer your question?
Yeah, definitely. We've been looking at different DocuSign features that are HIPAA protected to help us kind of move along with some of the new patients, because each practice has its own type of appointments that they see and things like that. And some things that can be done without a scan in our office, we would, of course, prefer that no one that doesn't require a scan, their appointments be done telemedicine, but some of those would be new patients to us. So thank you for your input on that, guys. I really do appreciate that. It's always so nice to be able to share ideas with your peers and see some of the things that are working and what aren't working. And to get an idea of pricing and things too is always helpful. And the flow and the change of making it fluid for our patients is so important right now, especially with anxieties as high as they are.
I see in the chat box that Amber Brown says that new patients for them have to complete registration and history forms on the website. And then there's a form signing piece in the MyPrivia app that supports that. And then Patricia Petrick is telling us that Backline has a feature that allows them to send those forms 24 hours in advance. And they're also doing that via email.
Great.
So this is Susan, just one comment. I've seen on a number of listservs concern expressed about physicians jumping into telemedicine using things like Zoom without the HIPAA compliant version, or FaceTime, et cetera. I understand we're in an unprecedented situation. The only thing I would just sort of counsel people is that the feds are definitely going to start cracking down on this when COVID-19 is over. And so to the extent that you can establish and candidly afford a HIPAA compliant product now, it would be better to kind of get used to that and implement that in your workflow instead of finding yourself very comfortable with one format and then needing to learn an entirely different format once we learn that the feds are going to start being HIPAA enforced in the future. So just a word of caution. And if that helps you make a different decision that you can get used to and that you will just continue using, I hope that's helpful.
Yeah, thank you, Susan. I feel like that really is helpful. A couple of the webinars I've been on recently about telemedicine, one in particular, the lady who was hosting that webinar does auditing for CMS and other insurance organizations, and they've already started to recruit her for auditings beginning in July. So I know we've got a little bit of a grace period here, but that's a very good point that you made, Susan. The faster that we can get all of our ducks in a row and make sure that there isn't anything that could potentially make us have to pay back funds or something like that in a time where we've already got limited patients, it's definitely a valuable piece of information that you said. Now, one of the really hot topics that I was really hoping to get some additional guidance from you guys on and to see what's working and not working in your clinics is the ordering of supplies. Of course, PPE, we all know that it's very hard to come by right now, but so are the cleaning supplies that we use so regularly in our offices. I'm finding myself shopping online. I find myself having to go into stores much more than I would want to, just to make sure that we have the necessary items that we need in our clinic. I'm interested in hearing now, we typically shop through McKesson, but we've had a lot of limitations on things that we can buy right now. Like we can only get one box of masks at a time. And when you see patients, those masks, they move really fast. So can anybody provide me with some of the information on the issues that they're having getting their PPE and their cleaning supplies, and what additional resources they found to be available to them?
So this is Susan again. Hopefully others will pipe in. Just while I have been on this call, I have been contacted by a company here in Maryland who has started repurposing their factory, which is an exhibit making factory, to now doing PPE. And so I've just very quickly looked. They are making masks, they are making gowns, they're making face shields that are replaceable. And so we'll be making sure that we share this information very soon after the webinar.
Amber Brown is noting that they were having trouble getting hand sanitizer, but they found that multiple local distilleries are now making it and will give priority to them because they are a healthcare organization.
Now, Amber, if you don't mind mentioning some of the names of those distilleries that are being more providing to healthcare providers, because I know sanitizer, though, you know, here in our office, we wash our hands constantly, but we like to have sanitizer in our common areas for our patients. And that is exactly one of the things that I too am having quite a hard time in getting sanitizer ordered. So I've been to a couple of the distilleries and left information, but recently Hogan kind of stepped up and took over some of that and is working with them directly. So I haven't been able to get the same supply I was before. But Amber, if you could please provide any additional insight on that, I would be happy to visit those distilleries myself, just to ensure that we have enough for our common areas for our patients. And it goes for masks too. Where is everyone ordering their masks from right now? I'm almost thinking it would be beneficial to us as a group to create our own listserv that indicates when we see an item has been restocked, so that people in our area can go ahead and order that item. I know with McKesson, it was a little bit difficult, you know, having that phone call when I called, all of my orders were being canceled and not back ordered, but being canceled. And when I called, they said, we just don't know when we're getting items into the warehouse. So we're just canceling those. We don't have a back order system. So you're just like constantly on the, okay, I'm checking again for the 10th time today. But I really think if we could combine our efforts as a group, it may really help us in that.
So she says that Lost Ark in Columbia, Maryland is one.
Oh, that's
and
great.
that there's also one in Rockville that she can't remember the name of. So I will, a Twin Valley in Rockville.
Twin Valley, yeah, it is Twin Valley.
And Ariel, just to Susan, with regard to your point about the listserv, we actually do have a listserv, and I think that would be an excellent use of sharing of information, but we need people to use it. And we actually did create this a number of years ago, and you know, the usage has ebbed and flowed, but I think that if we would encourage everyone, especially for this purpose, it could see new life again. So we also have had a little interest from practice managers in a separate Facebook group that could be used for this purpose and others. We did create one for physicians where they could go and share concerns and challenges and solutions, et cetera. And so I had several practice managers to contact me about whether they could also join the physicians group. And unfortunately, the answer is no, but I asked them if they would like to have their own. They have not responded to me because if I'm not a friend with them, that message goes into a different place. So it may take them a while to find it. But I just wanted to share, yes, we do have that particular listserv, but we also could create a Facebook group if that would be helpful as well.
Yeah, to go in a little bit more about that listserv, Susan, does the listserv have options for when you are to receive an alert? For instance, do you only get, one a day notices for that? Could you have real-time notices? Because between the two, if there wasn't, because as I mentioned before, it's almost like a clicking game. You just keep clicking and clicking. I know one of the practice administrators in my building was using another medical supply company, and it was kind of the same thing that he was picking up on as well, where it was kind of like you just hang out, ready to click, keep refreshing that screen. If we could find either the listserv or the Facebook that could give us real-time messaging, so if someone says, hey, sanitizer just opened up at whichever store it is, now's the time to get your order in, I think that would be great for us in the healthcare industry. And I love that idea, Susan.
So each person can go in and configure whether or not they want every email as it comes, whether they want a daily summary. So the person actually goes in and makes that choice. So we could certainly provide instructions about how to go in and change it. But I don't, Carissa, correct me if I'm wrong. I'm not sure that, can we default and set it to where everybody gets everything, immediately?
Yeah, like have a subset of a COVID-19 size.
Right.
When they first join, yes, but then if they go in and they change their own preferences, then we can't. It's locked to us. But yeah, I can make sure that that people are getting things as they're coming through on an individual email basis, and then people can define their own preferences.
Yeah, what other supplies are people having difficulty getting? Because I'm happy to share any additional supply access points that we have with others so that we all need bleach and disinfectant wipes and, our alcohol wipes and those necessary things for our clinics. Is there anything else that people are struggling to find in their offices?
One of our folks has noted here that McKesson canceled their face mask orders in early March, and that cleaning supplies, they're requiring a past purchase history in order to put in orders on them.
That is true. I did contact them about that. They're even canceling orders, unfortunately, if you do have a past history on purchasing that item. I noticed that with several of the wipes that we order, as well as sanitizer. We used to get sanitizer from McKesson up until COVID happened, and now we just don't have availability with them anymore. And how it was explained to me from the agent, I felt so bad for her because she really didn't have much information she could give other than you just have to keep checking. And if we can all work together on that, I think it would help us overcome some of the additional stressors that some of us are feeling on that. I know as a practice administrator, I am constantly shopping just to have our day-to-day. Thank goodness we've got plenty of toilet paper and paper towels to get us going. And I have tons of bleach to make, the right dilutions for the various cleaning in the office should we run out of the standard supplies that we use. But I'm hoping that it doesn't get there. I mean, even to get the gallons of bleach that we have wasn't necessarily the easiest. I did see, though, that most of the grocery stores have been great. When you speak with the management and you give them your business card and let them know that you're for a healthcare facility, they do hold items to the side for your group. I've had that happen with several grocery stores here, especially on some of the disinfectants. So that's been helpful to me as well. For those who don't have an opportunity to talk now, Carissa, will there be an opportunity for continued questions and things to be sent to you, or how should that happen?
Absolutely. So we'll do a post-event email. Obviously, we've talked about a number of resources on this phone call. So we'll make a digest of those so that people don't have to go searching for them on our website. And then that's always, the best avenue if you have follow-up contributions or questions. And then we're also we're going to send out an invitation to everyone on this call for that practice management listserv in case you haven't been on, or you want to update your profile and how often you're getting those emails, because I think that might be a really useful resource to everyone.
I think, Carissa, you guys have done an excellent job putting resources readily available right on your homepage. Just click the COVID-19. You have done an excellent job putting it together in an easy to read format, easy to follow, with links to click to exactly where you need to go to answer a lot of questions. But that leads me to wondering what other questions people are having right now. Is there anything that we didn't discuss here today that they may be struggling with, or may need a little bit additional support?
So Ariel, this is Susan. Yesterday, when the governor's order about essential services came out, we got a flurry of emails from practices saying, does that change anything for me? So I wonder whether we could have a few of the practice managers or physicians that are on kind of describe how they made that decision. And of course, some are completely closed down and not seeing any patients because most of what they do is elective. So I just wondered if we might hear from some of the people online about their own assessment of essential and how they determined whether to be open, closed, or use telemedicine or some combination. Thank you.
Now, I am very fortunate to work in maternal-fetal medicine. Our guiding organizations, ACOG and the Society for Maternal-Fetal Medicine, have done an amazing job with supporting the physicians and doing their very best to give the most clear communication to us as to, we're high-risk pregnancies. What can you not see in a high-risk pregnancy without putting your patient at risk? They've done a really good job. My first suggestion to anyone would be to lean on your guiding organizations, whether you're in cardiology or allergy, that you have your core that you can go to, your colleges that you can go to. I think that using those resources and the resources of the peers have been helpful. In our office, one of the things that we did, because we do need to continue to see patients, but we're trying to limit the number of patients at any given time. But yesterday we issued letters to our staff to have in their cars to show that they are essential workers and they work for our company, with Governor speaking on misdemeanor charges being had and stuff. It's just that extra protection, that extra security for our patient or our employees, where they feel comfortable and confident with something simple that we could do in providing them that.
Hi, this is Annette Pham again. Ariel, so nice to hear you.
Yeah.
My internet connection is unstable, so hopefully I am not going in and out here, but from what you were saying, I absolutely echo that. From the otolaryngology and all specialty societies involved with otolaryngologists, there's been almost daily communication with regards to some guidance for emergency and urgent type of patients. I think as a specialty, we feel that it is important for us to be able to keep any of the ENT emergencies that we can see in the office and out of the emergency room as much as possible. And I think that's why we've made the decision to stay open. And certainly, absolutely, after Governor Hogan issued that executive order, we did the same thing as an organization and made available these essential employee letters for our staff. And certainly, I think for morale, it's important for the staff to understand that, everyone it's great we're, you know, physicians, nurses, EMTs, the firefighters, police, but I also say the same thing to my staff. You know, they're my heroes for still, I know many of them are anxious and certainly reduction in hours and pay, but I think the thing is that we're all a team, and I am very grateful to my team for coming in as well. And I think just sort of bringing that to light every little once in a while helps as well. So that's how we manage.
Thank you, Dr. Pham. It's hard now, more hard than ever, to even conduct a staff meeting when you have more than 10 people. So to be able to communicate to your staff and have one local place for communication for them to access information. So even with the orders, it was almost immediate that we put additional information in the preparedness manual for them so that they had access to that. But as Dr. Pham was saying, just showing that support to the staff continuously, letting them know that they really are heroes. We are protecting our patients from going into the hospital and potentially being exposed to COVID as much as possible. We want that low and slow in the hospitals right now so they can maintain and take care of the patients appropriately. And that's why we're here helping them to do that.
So we have a comment from Dr. Quiro saying that their primary care practice has been open every day, primarily doing telemedicine, because they also are very concerned about crowds in the ER and wanting to keep patients out. And then I see a question in the chat box that says, under the Families First Coronavirus Response Act, are our employees exempt as a medical practice?
ADP did provide some more guidance to me on that yesterday, Carissa. So I've had many questions in relation to that. Really, it's dependent upon how many people are in your practice. And with being in healthcare, there is a possibility for exemption of that. Right now, there isn't a guidance as to who we should report anything to directly. I believe guidance is supposed to come out on that soon. They say under 500, but if you're less than 30 in your healthcare, there are exemptions for that. You just want to make sure you're documenting in your own records why that would be, what negative affect that would cause you for having your employees be out of the office during this time.
Well, and we are going to have a follow-up employment law session with attorneys from Paley Rothman. We've had about 400 different physicians access that resource so far. And obviously, you know, we don't want to be putting ourselves in the positions at the Medical Society of giving legal advice out, but we definitely want to connect you with the resource you need to get those questions answered. So I will note that as a separate follow-up for this specific practice, and then we'll get the general Q&A added to our existing resources so that's available to everyone going forward.
Now, for the physician in primary care, are you guys having a hard time getting your PPE as well? How are your medical assistants able to screen your patients coming in and such? Or are you doing mostly everything telemedicine?
So just this is Susan, another reminder that this survey that we're sending is really critical for all of you to complete because it does help us determine who's open for business, who's open for business via telemedicine. And so we are, by you providing us that information, then that is giving us permission to share that information with other physicians who are looking to refer or et cetera. And we also do get contacts from the public of people that may be looking for an open physician office or someone that they can see by telemedicine. So it's really important that you complete that for us. And that is going to be going out very soon to all of you.
Great, Susan. That won't be a problem at all. I think that's great.
So I see in our chat box that there's an orthopedics practice that's trying to do telemedicine, but they will continue to see patients for x-rays and injections. And I see similarly in the chat that other practices have noted, yes, only urgent visits in their office, and then everything is being passed over to telemedicine that's possible. So yeah, I will make sure that that link is in the post-event email, and just really encourage all of you to respond to it so we can get you onto a listing, and other practices can refer to you if they've got folks that are in need of telemedicine visit with a specialist, or even a specialist who knows that a patient's primary care physician isn't doing telemedicine right now. Okay, Ariel, are there other high points that you wanted to hit today before we close the session?
I just want to hear, lastly, how leaders in the organizations are helping to curb the anxieties. Because even as leaders, we have those same anxieties, but we want to make sure that we're strong for our people. I know recently I've taken into doing meditation to kind of help calm me down a little bit. But what are some of the things people are doing with their staff to help curb those anxieties? I would love to give my staff as much as I can, definitely.
Hi, this is Annette Vam. Thanks for that question. I think it's very important. I wish I could say that I focused on that specifically. I would love to hear what resources there are. I know certainly personally, and being connected and throughout this whole thing, and we were talking about social distancing, which is basically just physical distancing. I've still been trying to distantly socialize with people via forums. And then certainly the gym that I belong to does live stream classes, which I've done personally as well. My internet is really spotty. I don't know if anyone can hear me, but that's really it. And then certainly some meditation platforms like Calm and I think Headspace are offering free subscriptions right now for even, I think, 6 months for healthcare workers and such. And that's what I've seen.
Yes, a physician forwarded me an email recently saying that Headspace had been really helpful to them. And if you have an NPI number, then you can redeem that and get 6 months free.
Wow.
Yeah, the same physician also mentioned that Down Dog has made their platforms free for folks. So if you're interested in yoga or exercise, then those applications are offered to you at no cost. If you're, yeah, it's not just for healthcare professionals either. It's anybody who works at a healthcare organization right now.
That's great. I work for an incredible physician who's offered up yoga to our employees should they want to take it. So we'll see who will jump on that one with us. But other than that, I think giving as much information to the staff as fast as it comes to us. Of course, thinking through the best protocols for the office has been helpful. I find that when I sit down individually with the leaders of the departments and explain to them changes first and get their feedback on that and ask their comfort level has been helpful. I'm hoping that it remains this way. With so many unknowns, it's so hard to know what's right or what isn't the right way to go about communicating some things without instilling fear. Everybody's their own person. So it's nice to get this feedback. And again, thank you so much, Carissa and Susan, the Society, for putting this together. This really has been helpful.
All right, wonderful. Well, thank you all so much for joining us. I know we had some bandwidth troubles on my end as well, but we really appreciate everyone participating as much as they possibly could today. So I just want to remind you that if you are interested in additional educational content, we do have 3 webinars available on our YouTube channel, and we're uploading every week everything we can so that we can make all of that educational content available to everyone. We're also going to have a similar roundtable to this one for physicians. Dr. Pham, our incoming president, who is on this call today, she will be facilitating it. And then we'll have a number of physicians on to talk about how they and their specific specialty have been coping with the crisis. So everything from dermatology to orthopedics to urgent care to primary care. So we'll have a good, 7 or 8 different specialties represented on that call. So if you think that your physicians would be interested in that or find it valuable, then we would love to have them on that call. I also want to remind you that MedChi, the Maryland State Medical Society, has put together a call with the Maryland Department of Health that is an all-clinician call. And so that is on Mondays, Wednesdays, and Fridays. Monday and Wednesday, it's at 5 p.m. And then on Friday, it's at noon. So we have that dial-in information, and we are updating it on a rolling basis. It's also coming to you direct from MedChi to your inboxes. So if you're interested in that, or other clinicians who might be interested that haven't taken advantage of it yet, we've had dozens of members say that it's been extraordinarily useful for their practices. So we do encourage you to participate in that if possible. And then finally, I just wanted to draw your attention to the link that's provided at the bottom of the screen you're seeing now. That's montgomerymedicine.org/COVID-19. That is where we are keeping everything up to date, all the information, all the resources that we get in. And we're really doing a lot of work to try to keep that curated and as clean, but also as useful for your practice as possible. So, so please visit us online there as well. And with that, I will go ahead and close out this educational session. If you do have additional follow-up questions, please feel free to respond to our post-event email with those, and we will send out reminder links about our practice managers listserv and also that SurveyMonkey so that your practice can tell us if you're offering telemedicine, if you're still accepting new patients, etc. So thank you all very much, and I hope you have a great afternoon.
Thank you.